Hey guys, welcome back to the Diabesties channel. Jazz over here. And today what we're going to be talking about is something very important for all people with type 1 diabetes to know. And that is how medications interact with blood glucose levels. आप सबको पता है वायरल का सीजन चल रहा है and whenever there's a weather change, cough हो जाता है, cold हो जाता है, flu हो जाता है कभी-कभी. And we are very used to taking over-the-counter medicines and antibiotics and cough syrups. But it's important to know how certain medications interact with our blood glucose levels. तो पहली बात तो ये समझना important है कि जब भी आप unwell हो, whenever you are sick and ill, your blood sugars tend to automatically rise. This is because any kind of illness puts stress on the bodies, and that the body requires more fuel to fight that illness. So the body produces more glucose to give itself fuel to fight. Alright, so sugar levels आपको generally थोड़े से high लगेंगे. This is known. But it's also important to understand that certain medications that we take normally also might increase or decrease blood glucose levels. And I'm going to give you an example of few right now so that you can be mindful and you can then find patterns in your daily life if you are ever ill. So one tip that I would like to give is जब भी cough या cold होता है, you normally end up taking a cough syrup. I would suggest try to opt for pills and capsules as much as you can because certain syrups have extra sugar and carbs. There are now also a lot of sugar-free cough syrups in the market that you should try to opt for so that you don't have that added blood glucose level spike. Aspirin is another medication that has been known to lower blood glucose levels in young children. So if you are a parent or someone who has a very young child with type 1 diabetes, be mindful of that before giving your child aspirin. Pseudoepinephrine, which is the decongestant found in most cold medications, is known to also raise sugars. So make sure that जब भी आप कोई medicine लो, आप उसके पीछे ingredients देखो and see the quantity of those ingredients. And if there is pseudoepinephrine in it, just be a little mindful that it may cause an elevation in your sugar levels. If your doctor does prescribe steroids, any kind of steroids, it is known to really raise blood glucose levels. So make sure your doctor, your primary care physician or anyone you're consulting knows that you're type 1 diabetic so that they can give you an additional insulin dose if required. The second thing to be mindful of is that कभी-कभी आप अगर कोई medications ले रहे हो और अगर आप CGM पहन रहे हो, there could also be an interaction with those. For example, acetaminophen or paracetamol is known to actually give you false readings on your CGM. So if you are taking a paracetamol dose or you're taking it for multiple days, be sure that you also do a finger prick and don't rely completely on your CGM because it is known to cause interactions and inaccurate readings. तो ये जानना बहुत important है. And also, of course, if you are unwell, if you are sick, you know that you need to also check for ketones. So ketone testing strips now come in two forms. One is a blood ketone meter and one is a urine test strip for ketones. So अगर आप unwell हो, if you've got the flu, the cold for multiple days, you don't feel well, make sure that you check your ketones because like I said, your blood sugars will rise and you may require a higher dose of insulin for the time you are sick. Otherwise, you are at risk of getting ketones. तो ketones बिल्कुल check कीजिएगा. So मैंने आपको थोड़े examples दिए हैं of how medications interact with your blood sugars. The other important thing is to know what you are allergic to. For example, I am allergic to diclofenac. It's a pain-killing medication. And I am very wary that I do not take diclofenac in any form. So I think the main message I want to give everyone today is that when you're taking any kind of new medication, always look at the ingredients in the back and don't just take it blindly because certain ingredients you could be allergic to, certain ingredients could actually tamper with your blood glucose levels and certain ingredients could also tamper with your CGM values. So awareness is empowerment. Be aware so that you can take better decisions and you can feel better quicker without any added blood sugar spikes because of the medication. So stay safe. Please mask up even in the season right now. I know COVID is not there, but it's important to wear a mask in public places so that you keep yourself well and healthy. And let me know if this video has been of help to you and take care of yourself. We'll see you again in the next video. Till then, be very much type 1 of a kind.